Good afternoon, everybody, and welcome to the latest in our series of Eno Center for Transportation webinars. As you all know, Eno is an independent, nonpartisan, nonprofit think tank that shapes public debate on critical multimodal transportation issues and builds an innovative network of transportation professionals like you all on the phone today. We're also celebrating our 100th year, so you should certainly check us out at 100years.enotrans.org for our discussion forums, our Living Legacy podcast series, and other interactive elements as we reflect on the last 100 years and look toward the next. My name is Paul Lewis. I'm the Vice President of Policy here at Eno, and today we're discussing improving access for all, bringing on-demand technology to paratransit. Paratransit has been around for a long time, but really starting in 1990 with the passage of the Americans with Disabilities Act, it's become a staple for public transportation, enabling folks with disabilities to access their communities when they're unable to use fixed route transportation due to physical barriers or otherwise. But the high cost per trip, long reservation lead times, unreliable time travel has limited its appeal and has pushed agencies and advocates and riders alike to search for better alternatives. And so today, we brought together some experts to explore on-demand transportation as a way to augment paratransit services. So I've got 4 experts on the phone with me today who will kind of lead the discussion here in just a moment. First, we have Dr. Judy Shanley, who is the Assistant Vice President for Education and Youth Transition at Easterseals and is the Easterseals Director at the National Center for Mobility Management. We also have Ben Schultzman, who is the head of paratransit service at MBTA, and Paul Hamilton, who is a senior manager of paratransit services at Denver RTD. And finally, from the private sector, we have Chris Pangilinan, who is the head of global policy for public transportation at Uber. The format for today's webinar is a discussion. So we don't have any slides or presentations, but rather our panelists are going to provide some introductory remarks, and then we're going to launch into a conversation with some questions that I have as moderator, and then you all on the live webinar can submit questions via the GoToWebinar control panel. There's a questions function where you can type in a question, or if you need to, you can email us at publicaffairs@enotrans.org if you have a question that way, if that's easier for you. And while we don't expect any technology issues, we found that if you're having trouble, you can always exit and then rejoin the webinar. That tends to resolve some minor issues. And of course, Eno is happy to offer this webinar series free of charge. If you enjoy these webinars and are interested in supporting Eno's work, you can check out the link in the chat box to donate or to become a member. And as a first for today, this webinar is offering an AICP certification maintenance credit. It's the first time we've done this, so hopefully for those of you that are needing AICP certification maintenance credits, it's of use. You can, of course, click here, go to our website, and there we have a link where you can click for just instructions on how to submit for credits on AICP's site. With that, all that out of the way, I'm going to turn it over to our panelists, who I'm going to welcome to turn on their cameras now. And we're going to start with Dr. Judy Shanley, who's going to kick it off with some intro remarks, setting the stage for our discussion. So Judy, please go ahead.
Thanks, Paul, and thank you to Eno for inviting me, and thank you to the other panelists. This is a really timely and important topic, and I appreciate that so many of you have joined us this afternoon. I've been thinking about this topic for a long time, both in my role at Easterseals as well as my role on the National Center for Mobility Management, and I think there's 3 things that come to mind. I'm overtly optimistic about the future of thinking about paratransit in new and innovative ways. I think anytime we can improve a system, improve a service, that's a really positive thing. my caution is that individuals with disabilities have to be at the table at every step along the way. So whether it's planning, whether it's design, whether it's carrying out the service, I think we can't forget that the real voices of individuals with disabilities need to guide the service. I'm really enthusiastic about these partnerships, and in some ways I'm hesitantly happy. I'm thrilled that the transit agency is really taking time to consider these new modes of transportation. There's been inequity in paratransit over the long run. Paul shared with you some of the challenges that individuals with disability face, whether it's long time for reservations or cost. And so I'm hesitant in wanting us to think about how we can correct the not so good things associated with traditional paratransit. And I'm also hesitantly happy about ensuring that individuals with cognitive disabilities have access to the service. Using technology sometimes creates challenges for people with intellectual or developmental disabilities. So I want to be sure in whatever we do that we're thinking about the broad range of users of the service. And finally, I hoping that as we move forward with innovative services, we can think about seamless spontaneity. And what I mean about that is a paratransit model that's truly integrated in a continuum of service for all people. Often paratransit is a separate entity within a transit agency. It's a separate department, separate leadership. And I'm hoping that with the new and innovative ways we're thinking about paratransit delivery, that it really becomes seamless in terms of the variety of services that transit agencies offer, so that really it's not a separate and it's not an unequal service, but it's an equitable and full participatory service. So I'm excited to have dialogue with you and join in the conversation. Thanks, Paul.
Thanks, Judy. I appreciate that. And so now we're going to turn it over to Ben with MBTA, who's going to give a little perspective on what they've been working on in Massachusetts.
Thank you, Paul, and thanks for everyone joining today. So just about, I would say about 4.5 years ago, we embarked on a little pilot with Uber and Lyft to figure out how we could hit on many of those exact issues that you have said, of whether it's plagued or just been a part of the daily lives of paratransit customers, particularly around service quality and cost. And it was the first partnership of its kind in the country. And we wanted to see, could we do two things? One, could we improve the quality for customers, but also could we do it in a more efficient way for the agency itself? And after 4.5 years of running the pilot and a lot of great war stories along the way, we're really excited on what we've been able to build with our partners to date. There were a lot of questions off the bat around, could this be done? Would individuals with disabilities or seniors be able to use services like Uber and Lyft? Were they tailored for them? Were they able to meet all of their needs? And again, through a very thoughtful, iterative process, we were able to make the service something that at this point, over 5,000 customers have used, over 600,000 on-demand trips have been delivered, and customers in the pilot have taken over 1 million trips in total. And so I think it has surpassed all of our and our customers' expectations to date, not without some bumps along the way, but it really has become an important part of our paratransit service offerings to customers. And it's, as Judy was saying, it's not just traditional paratransit service for the MBTA. It's how do we think about the holistic sets of modes and ways that we can transport our customers in the best way for those customers and the most cost-efficient manner for the MBTA too. We've been able to deliver on these results of reducing costs and improving the customer experience across on-time performance, customer satisfaction, increasing in actually the number of trips we can get customers to take, really through a couple of key ways that we'll touch on, I'm sure, through many other questions throughout the presentation. But it really took good partnership, took a lot of piloting and testing and iterating on the design of the service that we were able to put together. It took a keen focus on data and making sure we had the right data to track our customers' behavior and make sure that we were designing it correctly, but also the right behavior to understand, was this working for the transit agency itself? And probably most importantly, it was the beginning and it was the end. It starts with customer input, as Judy also said too. So designing a service that customers need and making sure to check in with them that it's actually meeting their needs too. So a lot more to talk about on our journey and how we've been able to integrate this into our broader services and where we see that going next. And I'm sure all those questions will come up as we go throughout this.
Thanks for that, Ben. That was great. And I think there's already a bunch of questions coming in on that. But before we get into some of those specifics, we want to hear from Paul Hamilton, hear what's going on at Denver RTD.
Thank you, Paul. And I think a testament to how many people have already logged in indicates that we're all trying to learn. I will point out that you're here to learn from some of us, and we've been doing the exact same thing in Denver. We're only 2 years in trying to put together a pilot, less than 1 year in actually running it. And we were reaching out to MBTA 2-3 years ago, trying to learn from them and doing exactly what you're probably thinking right now, which is, if you were to do this again, how would you do it different? What might you change? But in terms of what we're doing right now, we're in the middle of our pilot. We started a 4 zip code service area in Southeast Denver that's got a relatively saturated high demand service area that we could actually pick from, which has been especially important being that we rolled out our service in the middle of a pandemic when demand was potentially low to begin with. But we were trying to find ways that we might increase the adoption of our on-demand service. We already have an on-demand program. We've had an on-demand program since 2005, but we were starting to see a loss in the number of people that were actually going into that program. And more importantly, the number of people that have been using our on-demand service in recent years had not only been declining, but they had been shifting to our off-peak times. And what we're looking to do is try to do 2 primary things. See if we can find a way to, through subsidies and modified subsidies, push people or encourage people to use the service at times we desperately like them to during the peak, and provide a internal mechanism to assure that our response time for people needing wave or wheelchair accessible vehicles allows for similar response times. And that's not something that we've been able to do with our current taxi providers that are another part of our on-demand service program. So far, we've seen an average, and again, we're very young in this, of about 250 trips per month. We're at the end of phase 1. We've just started phase 2, which will be using our wheelchair accessible vehicles through one of our service providers, MB Transportation. If you take that across at our present adoption rate, we're already at about a 3,000 trip per month rate, which would be, or would comprise almost 30% of our overall trip demand. And what we've seen as the pandemic, and I think Judy touched on this earlier, what we've seen is a real paradigm shift as people have come back to ride the vehicles. They're not riding vehicles at the same rate yet that they were pre-pandemic, but they're already at 50% on paratransit. It's a need. It isn't always a want or a choice. And what we're really seeing is when it comes to our on-demand service, we're already at 85% of our pre-pandemic levels. So offering a choice now that will work for people and trying this out and making sure it works best for our customers, we see as an opportunity to get folks to try this out before that paradigm shift that has unstuck them from the previous behaviors refreezes. We'd like to obviously see them adopt something that works better for them and is less expensive, more efficient for us. And I'm sure we'll have a lot of questions to expand on that. I could go on and on because we, like everybody else, we've been learning as we go. Probably made plenty of mistakes, but that's really what a pilot is all about. I'll turn it back to you, Paul.
Great. No, and I just want to clarify. I think I heard you say that you are already at 85% of pre-pandemic levels for paratransit. Is that right?
We are.
That's
yeah.
pretty incredible.
Yeah. What? I'm sorry. We're at 85% for our on-demand service. So,
okay.
Not surprisingly, as people are coming back, even if they're vaccinated, the first thing they want to do is get back to where they've been going, but they'd still like to consider doing it in the safest way possible. And obviously, being in a one-to-one relationship with a driver, whether it's taxi or Uber, that's appealing. So yeah, we're at 85% right now for our on-demand service. Our paratransit service is at about 50%.
Got it. Thanks for that. Okay, so let's turn it over to Chris. Chris is going to provide a little bit of a perspective from the private sector. I know, Chris, you've been working with some of these agencies and others around the country.
Yeah, thank you, Paul. And thank you, Paul, Ben, and Judy for your remarks. They were great. Great way to introduce the topic here. Yeah, and so at Uber, we've been working with public transportation agencies around the country, and in particular here in this case with Boston and in Denver, to provide the technology to bring either agency vehicles and operators on demand for riders, or provide the transit agencies and riders access to the on-demand network that is on Uber, whether that be on the traditional Uber X, like Paul was describing earlier, the one-on-one kind of ride, or Uber Wave, which is a wheelchair accessible vehicle, or when the pandemic ends here, Uber Pool, which we had prior. And generally speaking, I think the previous three speakers said it really well, but that there's a strong advantage with on-demand paratransit that we're seeing, not just for the riders and the agencies, but potentially for the overall community as well. And first and foremost, being able to deliver these kind of improvements for paratransit riders is fantastic. Judy, you captured it really well, that there's this move that potentially to unlock, I think you used the words seamless spontaneity, which I love that phrase. And I think that is ultimately the bottom line here of what we're trying to provide with on-demand paratransit. Back in 1990, when paratransit became a little more official than it was before that, it was really a way, a stopgap, if you will, as agencies got their buses and trains to be more accessible for people with disabilities. But it's really become this way that folks who are still unable to access fixed route public transportation, whether it be due to sidewalks or other infrastructure and preventing that, or the buses and trains themselves, to get to what they need to do and live their lives and really live the maximum potential of their lives and really have that spontaneous, seamless spontaneity in their day-to-day work and life. And so it's really hard to overstate what these benefits are, unless you kind of imagine, you're limited to these 24 or 48 7-day reservations, 30-minute arrival windows, which, again, not the fault of the agencies, but kind of the framework that they were working in given the law that was constructed. And yet now we have this on-demand service to provide this kind of spontaneous travel, which opens up a whole new level of benefits, and really can go beyond those stereotypical work and medical appointments and into other real life trips that are just as critical to people's well-being, such as shopping or seeing friends or recreational trips and other areas. And of course, the agencies, the benefits that they can get in the ability to deliver these services to their riders, and start to see the ADA not as this as a ceiling, but rather as a floor to what the services that are provided to people with disabilities. And of course, the cost effectiveness that is seen, that Ben and Paul both hinted at in their remarks. And finally, what I'm really excited about too is the potential for this kind of partnership and this kind of work to expand on-demand wheelchair accessible vehicle transportation to the broader community and not just to paratransit users. And what I mean by that is that traditionally our system of private automobiles, which dominates the American landscape, is generally speaking very inaccessible to those who need wheelchair accessible vehicles. And seeing that this potentially could bring about more on-demand transportation, not just to paratransit riders, but in an integrated program, potentially those same vehicles available to everybody else, being able to hopefully smash this last barrier here to integration beyond beyond these barriers of transportation that have existed for so long. So I think that on-demand paratransit is just getting started, and I think the potential of it is much higher than we might even think. So looking forward to the discussion here, Paul, with the rest of the panelists and the Q&A from the audience.
Great. Thank you for that, Chris, and for the rest of the panelists too. I welcome everyone to turn on your cameras so we're all here, and we're going to answer a bunch of questions. Some of them I've been cooking up over the last couple minutes as I've been listening to folks, and then I think fortunately some of them are similar to what a lot of you are asking here on the phone. And so one of the things that I want to start with is you all mentioned about how on-demand paratransit can transform mobility, and I'd like you to elaborate a little bit more on some of the specifics and what are some of the specific things that measurable outcomes that we've found in terms of increased access and mobility, and what are some of the riders saying about this? And so let's start with Ben and Paul first from their experience at the transit agency, and then we'll have Judy and Chris jump in after that. Ben?
Thanks, Paul. Yeah, I think both the numbers and the stories are really what's amazing here too. When we look at our customers, we see that they take on average 33% more trips than they ever did before when we compare that to what they did before getting in the pilot to where they are when they're in the pilot. And yet that still allows the agency to save some money too. And so it's really an amazing combination there. And that's nice from a numbers standpoint. But when we've gone out and surveyed customers and talked to our advocacy groups, the stories are really what's even more impressive. A lot of customers saying that, yes, they would have used paratransit. It's the ride for the MBTA in the Boston area, but just they didn't realize that they were going to go to the movies on a Friday night until an hour before doing that. And those are the types of things where just paratransit, as Christopher said, it's just not designed to be as flexible and able to react to how people actually move throughout cities. And so there are hundreds of other stories exactly like that. It could be for going to medical trips because now they don't need to potentially arrive extra early just to be guaranteed that they will see their doctor on time. Sometimes it's actually leaving dialysis appointments because it's just easier in order to not have to be taking a longer, more circuitous route back home because of their current condition and how they're feeling after a treatment. Or again, it's just going to a birthday party or something that pops up last minute. And the benefits of on-demand transportation are really huge from that standpoint. I think the other piece that we hear a lot from customers is having the information of where their vehicle is in real time. It's not just the ability to book last minute, but it's the ability to actually see and realize that, oh, my vehicle's running a little bit late. Let me sit inside in a cold Boston winter and wait for my vehicle versus waiting outside. And I think those are the types of things that are exciting to have learned through these pilots that can be directly translatable back to paratransit. And then there's some other elements that you cannot replicate on the core paratransit service that we want to, push us to continue to want to offer this as an addition, not, in replacement of the core paratransit service.
Okay, that's really interesting. Paul, some thoughts from you?
There we go. Yeah, I think a lot of what Ben just spoke to is the same thing that we're seeing. Obviously, we don't have the kinds of numbers yet or the depth of data that he has to be able to see how those trends in ridership using Uber compare to using our current excessive cab on demand program or even versus regular usage. But what we heard in the sampling that we took in a survey prior to pushing this out there is very similar to what Ben was saying, which is folks simply want to have the same choice in getting from point A to B that anybody else who doesn't have to rely only on paratransit would have. If I want to take a trip by car, bus, train, I want to make that decision the day that I need to. And that can be anything from going to the doctor to what we witnessed when we put a food service delivery program out early on in the pandemic, which is, look, if you're going for groceries, the last thing you want to do in July is wonder whether or not your plus or minus 30-minute window is going to come before your ice cream melts. There are a lot of reasons why people should want and need the same kind of service. And it gets back to what Judy had said earlier, which is it really is about equity. We're trying to create options, not only in this program, but in similar programs. As Ben said, we're learning and pushing that back into what we do with our regular paratransit service. And just 8 months ago, we had pushed out an app on our phone that allows people to see their regular paratransit trips and where they are very similarly to what they would if they were looking to use Uber. And it, in our case, doesn't always mean they're going to get there any faster than they were originally predicted, but there's something about the confidence of being able to see where that vehicle is that really comforts folks when they know the bus is actually coming.
That's great. Judy, any kind of thoughts, any more specifics from your perspective?
Yeah, I like to know when the bus is coming too, Paul. I was doing some research, and the American Foundation for the Blind did a study last year, and they asked individuals with visual disabilities who are blind about their riding preferences and the stories, the cases, and the top thing that was noted by the individuals with disabilities, they wanted flexibility and they wanted timeliness of service. And in thinking about the benefits of all of this, you know, we work really hard. I'm an educator by background, and we work really hard to educate students with disabilities and in general education settings, so they're not pulled out into a special education setting. We work really hard to facilitate employment outcomes and post-secondary outcomes for individuals with disabilities to work in inclusive settings. And so why would we separate individuals and put them on a stigmatized service if, you know, the real push is to have people work side by side and have access to the same services in a community as everyone else. And when I talk with some of the individuals that I work with both at Easterseals and the National Center for Mobility Management, this reliable service and having that flexibility really increases my predictability as a worker. I'm able to get to my job on time. I never have to say to my employer that there's challenges with transportation. I can access the health care I need so that my health is better, my conditions are better. It really is less stigmatizing and more normalizing in terms of the services that everybody has access to. So I'm hopeful that the seamless, the spontaneity is going to be there.
That's great. Chris, anything for you to add?
Yeah, I'll just add that I think these are all absolutely important, and that, you know, one way that we want to capture this is, you know, a lot of talk about performance metrics and how we measure success. And I'm sure Ben and Paul have more thoughts on this, but, you know, I'm thinking in terms of like just the stories, especially the ones that are Judy just listed out here, are so important to capture. And in public transportation, not just paratransit, but in general, you know, how do we as an industry move beyond our quantity of consumption measurement all the time and get more into quality of service measurement? And I think that's going to be key for public transportation to really demonstrate its story, and then to recognize the importance and how much of an impact these kind of projects can have. You know, even if Ben and Paul's agencies didn't see one, you know, increase in trips, even though they did, but even if they saw no increase in ridership, but all they saw was an increasing quality of service, that needs to be captured, and really that story needs to be told to the folks in Boston, to the folks in all around the country, because I think that's how we, you know, justify public transportation and really understand its impact to the lives of people that we're serving every day.
That's great, and I've, you know, how we do have a big focus on capturing data and those kind of things, and so trying to capture everything I think is important. And one thing that you did bring up in terms of data, Chris, earlier, was the cost effectiveness, and there's a bunch of questions that have come in, and something that I've been curious too is that the increased usefulness, right, the increased quality of service should drive up demand for paratransit, and I think that there's a lot of pent-up demand for this type of service, given the fact that there's so many challenges with existing paratransit service, which is a good thing. Except it could potentially drive up the total overall costs. And so I'd like to talk a little bit about the financial implications of this. And Chris, I'll start with you here as somebody from the private sector who's been working across the country. And then I also want to hear from the rest of the panel too. But what are the financial implications for the public transit budgets? And how should agencies kind of control demand, or should they control demand? Is that, you know, what is the right approach to dealing with this balance between providing something that a lot of people want and making sure that you have the budget to make it happen?
Yeah, this is obviously a good problem to have, but it is a issue nonetheless that needs to be addressed. And I think what the interesting situation here is, going back to my performance metrics question discussion, there is a question that every agency has to ask on their own, which is it worth potentially, you know, yes, fewer dollars per trip, but it might end up being more dollars overall because of the increased demand. But you're getting such an enormous increase in customer benefit from that, and serving your riders better. So being able to balance those benefits and costs is the first thing that every agency needs to do. But of course, costs are, people want to manage that as well. And so there's ways to do this, of course, which I'll let the rest of the panelists go into details more about that if they'd like. But in terms of either capping the subsidy that you want to provide, capping the number of trips per month or the trips per week is another way. Of course, these are all, to put it bluntly, rationing service. And so, as people with disabilities have seen their services, not the best in the world, and they want to see them better and better, I think the rationing word can be a pretty negative connotation. That finally we're getting something we really like, and now you're going to limit our access to it, right? But at the same time, we want to make sure this is financially sustainable in the future and does have a future to keep going. And so I think it's a tough trade-off, but there are mechanisms to make this work such that if not every trip gets made, most trips get made, and there's still substantial benefit for riders that are available, despite needing to perhaps make sure that the budgets don't blow up completely with these kind of projects.
Got it. Paul, Ben, how has this worked at your respective pilots and agencies on this?
Well, I know that for us, during the pilot phase at least, we are rationing service, and we worked with Uber to set that up so that people could take up to 4 trips per day on average. We're only doing it during the weekday. Currently, we're only doing it during peak service, in large part because we wanted to see whether or not we could drive down the number of folks that were riding the paratransit bus at times that it became very costly for us to use that other mode. So we're providing something that works for the customers during peak that also helps us trim back the demand on our peak fleet. That in the long run could actually end up saving us money and allowing us to provide trips for people who can only ever use paratransit as their delivery option. They're going to get better service too. But yeah, to Chris's point, I think even Judy mentioned it, there isn't one right answer, and we're going to have to think this through with our advocacy groups and say, look, there are pluses and minuses to constraining how much service somebody gets. But if we're giving somebody some number, 3-4 trips per day, it's reasonable to assume that most people can go out and do what they need to do. Or we can constrain it in terms of what our subsidy is right now. It's a $20 subsidy. So you're going to be in about a 4 to 7 mile trip radius. And that might work really well for a lot of transit systems. We've got 2,300 square miles in our service area. So our average trip length right now is 12.5 miles. It's reasonable to assume we will always need to continue to provide paratransit as our primary backbone or primary service. But we can still see on demand as providing a large quantity of trips that make service options better for our rider base.
Got it. Ben?
Our number one complaint over the past 4.5 years is that people want more trips. So that's a good place to be to a certain degree, but it as Chris says, like that is, we are in the business of trying to provide transportation to people, and so the more that we can offer to people, the better. And in many cases, as long as again the service quality is there. So we. At the same time, I make a joke about that being the biggest complaint. If we did not have some limits on the number of trips that we gave out to customers every single month, and essentially what we do is we base it on your past ride history. So those who were super users will get more trips than those who are brand new ride customers, and we will adjust those trip caps over time. So there is the question of trying to be as fair as possible in the way that we do it, and I'm sure nothing is perfect, but if we did not do that, I'm sure the service would not continue to exist, for the past 4.5 years or be a part of our long-term plan, just because of the realities of the budget cycle and needing to at least manage the budget, not necessarily saying that we're, limiting trips, but managing the budget there. So it is a critically important piece of the puzzle to figure out when starting to pilot these services. As we know, once we introduce something, it's very hard to roll it back. And I know other agencies have had difficulty in this space too, but there are lots of different flavors, and there's a lot of different ways to potentially customize it to the needs of a certain transit agency. Like Paul, we started out with a more limited total amount of money that we would spend on a subsidy, we actually increased it because we saw that the most expensive trips for us to deliver on our paratransit service are the longest trips that are the most inconvenient for us to deliver. And so we felt like it was worthwhile for us to increase the subsidy up a whole lot higher to actually increase our miles per trip. So a lot of different numbers out there and metrics to use to tweak and tune the service, but fundamentally, because the core service is ADA paratransit, you've got to at least be cognizant of making sure you have the funding to deliver that. And then these additional services, it's important to then understand how you integrate those in.
Got it. And Judy, given your position not being in an agency, what's some of the advice that you would give agencies and kind of how to balance this?
I could not get off this webinar if I didn't mention the Coordinating Council on Access Mobility, CCAM. That's that federal push for the 11 federal agencies that have anything to do with transportation to coordinate. And it seems like now more than ever, it's an opportune time to knock on the doors of other agencies, Health and Human Services, Department of Labor, the VA, to chip in, to support transportation costs. Transportation underpins everyone's ability to access employment and jobs and good health and community. And so why not share the costs and think in non-traditional ways? RTD has been doing this for a long time, where they're using funds, not just from traditional FTA dollars, but from varying agencies to support transportation. And so maybe this is a nice opportunity to have conversations with people that typically we don't have conversations with to support transportation.
That's great. I'm going to shift gears a little bit, talking about some of the specifics of the pilots and how things are operating. We've got a bunch of questions about that, and one of the reasons why we brought on Ben and Paul is that the MBTA and Denver are kind of taking some different approaches in how they're structuring their agreements and working with the private sector in terms of hiring the drivers, procuring the vehicles, those kind of things. So let's just talk about that real quick, about how the service works, how your different contractual models look like, and as you're talking about that, how does it work with the existing paratransit service to augment what you have? And we'll start with Ben and then go to Paul.
Yeah, so up until now, we have kept them essentially separate. So customers have signed up for the on-demand pilot, and we've had Lyft and Uber and Curb be providers throughout the course of time. So we give customers choice there, which has been really important to make sure that they can choose their provider that works best for them. And then they have provided the vehicles, the wheelchair accessible vehicles in different amounts, to make sure that they can balance that appropriately with demand. And then we've basically offered customers, you pay the first $2, we'll pay up to the next 40, and then customers are responsible for everything over that. They don't need to do the math on their own because all of the apps do the math for them. And so it just shows the actual price to customers. And then customers get an allocation of trips depending on their past demand in the ride system every single month, and then those refresh on a monthly basis too. So that's kind of the nuts and bolts of how it's run. We have over times done some different ways and tweaks to the pilot. We've worked on ways to help subsidize and incentivize increases in wheelchair accessible vehicles with our providers to help essentially kind of, if we build it, they will come type of scenario. So we heard many times from customers that there were not enough wheelchair accessible vehicles, therefore they were not willing to show demand. The providers would say, we're happy to put vehicles on the road, but we don't see enough demand. And so we tried to help essentially bridge the gap there. We've also experimented in ways of allowing customers to call up through our call center, which takes our reservations through our traditional paratransit service, and have worked ways to essentially allow the customers to work with the call center to replace some of their existing paratransit trips with Uber, Lyft, and Curb too. So we've experimented with a bunch of different ways. We have an RFP that is closing, or the contract should be signed in let's say 3 days ago. So hopefully in short order we'll be able to put a lot of all those lessons learned and practices into play for our new version of the pilot. But we're really excited to take all those lessons learned and continue to evaluate how things should be improved going forward.
Paul?
And I'm excited that there's folks out there like Ben who had been experimenting with this long before we got into it. Their system was actually one of the ones that we asked early on. What did you like about the way that you deployed this? What do you not like? And we went to the next step, and we're already finding things that we're thinking about or rethinking. And I'll just mention one off the top of my head, which is one of the things we like about using Uber is you only pay for as much subsidy as you need to get your trip performed. So we do a similar model where they pay the front $2. The customer pays the front $2. We pay up to the next $20. They're at $40. But more importantly, if it's only a $12 trip, that's all that's going to be charged. With our taxi subsidy model right now, the only process we've ever had is every single call comes in through dispatch. They all then end up getting pushed out to whichever taxi vendor the customer chooses. And if it's a $12 subsidy, it's a flat subsidy. They're going to get all $12. It doesn't matter how far they're going. So it's nice to be able to have a product like this that makes us think that going forward, one of the very first modifications we may be making is adding on some of those longer trips, because what we know right now at $20 subsidy, it's unbelievably less expensive for us to be able to provide that service through Uber than if we provided it ourselves. Our average cost to provide a trip, even pre-pandemic when our demand was high, was close to $60 per trip. So we're going to win. The customer's going to win with better, more responsive service. One of the other things that's worth pointing out in how we went about it a little differently was we had heard from multiple providers that were already out there using Uber and Lyft as an option that they weren't quite as responsive with their wheelchair usage. No matter how much work you do in advance trying to come up with that right number and create an entire separate fleet of vehicles to be your wave vehicles is always problematic until you have some time under your belt. And we just determined that, look, we already have 3 service providers out there. They all have lifts. We would rather do the wave component ourselves. If we need to add more vehicles in, we can add them very quickly. If we need to par back and say, look, we only need 4 vehicles in this service area every day, we can do that. So it allows us to be more responsive for our customers and assure that every single person, regardless of their mobility device, is getting the same response time. And that was important to us.
Very good. Anything else from Chris? Maybe you have a thought here on different models, because Uber's worked with a lot of different transit agencies. Is there a third or fourth approach to this, or is that kind of the main 2 buckets of how organizations like transit agencies partner with organizations like Uber?
Yeah, I think we're starting to learn a lot here, and Ben and Paul have been great examples of like what we've learned over the last 4 years, and they've been doing a lot of great things implementing these different models. Another one I'll mention is Marin County, where it's not necessarily a paratransit program, but they did bring 4 of their vans onto the Uber app, and those vans are wheelchair accessible and owned and operated by the Marin Transit Agency. And what's fascinating about that is, while it's not paratransit riders do get a discount to use them. Non-paratransit riders can use them like regular public transportation. And that gets at the seamless spontaneity that Judy was saying earlier. This is not a separate paratransit program, but rather it's a wheelchair accessible program that's on demand for everybody. Now, Marin's a little bit of a different use case. It's a very wide service area, a little bit less dense than Denver and Boston, but it does show another example. And I think, we're all going to be learning. I think that's the key theme here in this webinar, is we're all learning like what are different models that can work in different communities, and to make this work. And one thing I did forget to mention that I think would be a really great opportunity is, as we think about the next transportation infrastructure bill and the next investment going forward, this is an amazing time to really jumpstart this opportunity to get agencies to learn from the Bostons and the Denvers around there and continue to develop these lessons and distribute them among different agencies to see what kind of model does work best for my community.
Very good. I'm going to touch on something that came up a little bit, and it's certainly come up in the question box that I've got here, is the issue of on-demand paratransit and workforce, specifically drivers. And maybe we'll start with you, Judy, to kind of provide some context here. How are these services received by the existing unionized workforce? how can agencies address labor concerns, and also looping in, what kind of training do agencies need to provide to the drivers to make sure that this is an equitable and accessible service?
I can't speak so much about the union issue, but what I can speak to is the kind of skill set and the knowledge and the awareness levels of operators and all people in the system, whether it's someone answering a phone, it's a customer service person at the other end, is respecting the differences and the variability in people, and particularly individuals with disabilities and their different ways of communicating and different expressions. I think understanding the Americans with Disabilities Act, the ADA, is important as a foundation. I don't think that operators or agency personnel actually in the vehicle have to be so technically expert in the ADA, but I think understanding what the parameters of the ADA are important. But I think just the empathy and awareness that a rider may have different needs based upon a disability, whether it's a mobility challenge or a cognitive challenge, that's one of the most when I speak with individuals with disabilities around the country, the respect and the communication from operators is probably one of the two things that are most important to riders. So.
Got it. Yeah. Okay. Ben, maybe you can take this one on. I know that this is something that you've experienced at MBTA at the agency level, and then we'll go to Paul and Chris.
Yeah, I mean, I think fundamentally, we have not used our operators on the platform. I think there are many ways to use kind of like what's happening in Marin and how Paul is doing it too. But we don't see very early on in the pilot, people would always ask questions to try and trick us into an answer of saying, well, is this just going to replace all of paratransit? And the easy answer to that is no. That there are things that this is particularly good for, and there are other aspects of paratransit service that will not be fully replicated by these on-demand modes. And so from that standpoint, there will be a need for kind of all different types of labor to help deliver on the service that we want to deliver holistically for our customers. So we've not had any particular issues to date. It is something that clearly, as we get more and more integrated, it will force more and more of the conversation. But we see it as an opportunity to have essentially meet customers where they are. Certain customers need higher levels of service and attention and door-to-door service as we provide in Boston, and others just need help navigating the system, but they don't need help getting in and out of the vehicle. And so I think providing customers as many potential options as possible ends up being a really beneficial way to provide service to them. And as a result of that, having different mixes of labors and ways for people to travel is the direction we're going in.
And Paul, I suspect it's a little different in Denver's, and you've operated on a different operating model. But can you talk to the same issues about labor and workforce?
Well, different but similar. I think one of the things that comes out is the fact that we are ourselves providing the lift-equipped vehicles is, to Ben's point, there are people that you need to meet where they are. People have higher needs. For the most part, and a lot of reason for that has to do with our customers who need a lift-equipped vehicle. Those are going to, whether or not they're using a wheelchair, be some of our most difficult to transport passengers safely. We need to know how to transport them, board them, secure them. All those things are, we have like a 3-week training program before one of those drivers ever sees the street. There are same drivers that do our paratransit services. So we know that they have the training required for that. But one of the things I wanted to point out is, I believe, and I don't know if it's at MBTA, is somewhere in the Boston area that they're in the process of working with CTAA to create a training program that Uber drivers can opt into. And that's not something that I know that much about yet, except that I've heard about it. But it may be something that you, Paul, or Chris may want to speak to now, or provide the listeners later, because I think that might be the next place we want to go, is providing that sensitivity training. for our drivers that are going to be performing those services for our passengers.
Yeah, Paul, I think that's right on the training side. You know, we're working with CTAA on training for not just paratransit drivers, but general on-demand wave drivers. And I think it's a great way to get expert training, you know, where it's needed from a great organization. And I think that you know, the flexibility of the type of service, the type of model, I think is the way that different agencies can address how they want to approach, you know, how they want to deliver the service. So for example, some agencies might want to just go with the TNC model and have, of course, their traditional paratransit as well as TNCs on demand. Some might want to do a mix of their own vehicles, kind of what Paul's doing, and TNCs. Others might want to do purely their own vehicles and their own operators, but they want them on demand. And I think what's great about what we can do for them at Uber is giving them all three of those options, and have the app be the interface, if you will, that riders can call an on-demand vehicle, and whether it be an agency vehicle or not, all up to the agency and the rider community to determine how best to do that. And harkening back to Judy's point from the beginning, you know, as long as the riders, the people with disabilities, are at the table and helping form these partnerships and these pilots, you know, the better outcome will be for everybody involved.
Got it.
It's also, the training piece is also a really great opportunity for transit agencies to knock on the door of the human service organizations in their communities. You know, Easterseals has a network of close to 70 affiliates around the country whose expertise is in disability etiquette and disability awareness. Why not invite those folks in? You know, they're probably formally involved in some way in a coordination plan, but invite those entities in to provide the kinds of training and supports. Local universities, the preparation programs at local universities are a valuable resource to understanding disability. And we're doing a project on the Eno Center that's looking at university programs in planning around the country and seeing what are those programs educating future transportation planners about disability and the ADA and all these kind of you know, innovations and accessibility topics. And I think that should be part of every transportation related preparation program. Everybody should have at least a baseline understanding of diversity and accessibility and disability awareness and the implications for travel.
That's great. So I have a couple questions coming in, taking some notes here. One, and maybe this is just a question specifically for Ben and then maybe Chris, about the vehicles themselves in the model that MBTA is using. How is it a challenge to make sure that we have wheelchair accessible vehicles, particularly when OEMs are not producing? I mean, most private cars are not wheelchair accessible. How do we get around that barrier, right? They've obviously tackled that to some degree in Denver by using agency-provided vehicles, but in the model that you're using at MBTA and perhaps in other places in the country, how do we tackle that specific issue?
I can give a broad overview, and then at least
go ahead.
Chris can go into specifically what Uber's doing. I think we have the benefit of we've had multiple different providers try out different ways to make it work. We've had some providers over time. I think Uber in the early days was working with local taxi providers who had wheelchair accessible vehicles already in their fleet. We've tried ways of, you know, Uber and Lyft and others contracting out to other providers to ensure that they're there on a regular basis. We as the team have found out different ways to incentivize that, talking about different ways to either incentivize the purchase of vehicles, incentivize hours on the road, or incentivize the completion of trips in wheelchair accessible vehicles. So we've been continuing to experiment. I don't think we have the perfect single solution yet, but it has been really helpful to see different ways to try and meet the needs of our customers.
Yeah, you know, it is a learning process and to find out what the right model is for this. We've done all the things that Ben has talked about, and most recently with MV Transportation, working with them as a fleet provider of wheelchair accessible vehicles in numerous cities around the country, including Boston earlier. And I think you know, the interesting thing is if you drill down to the core part of the issue here, besides the OEM problem of not having enough waves in general, is that people, you know, in the Uber model don't usually have their own waves they want to bring onto the platform themselves, if they even have one. And if you're a driver and you're trying to find what vehicle can I use to drive on Uber, for example, it means that a sedan is usually the most attractive option. It's cheaper to use than a van. There's no need to put a lift in it, and I'm getting the same fare. Uber doesn't charge more for Wave versus UberX, for example. And so there needs to be an incentive for a driver to choose to drive a wheelchair accessible vehicle versus a non. And so I'll also be looking over the next year at this issue to figure out what is it that we can look at to get at this and get more waves on the street. Judy, again, I keep quoting you, Judy, because you have such great insights here. But the one thing you said earlier about the coordination among agencies, there's a lot of different agencies, both at the national level and at the local level, that are paying for wheelchair accessible vehicle transportation. It doesn't quite make sense for that money to be spread out like peanut butter. If we could just focus those resources, we might be able to find a solution to get a Wave vehicle, on a street that is paid for by multiple sources, yet available to everybody, whether or not you're part of a program or not. And I think that is the way that I see things going forward. Again, a very early work on this, but I'm really excited about the potential here. And in paratransit, the work that Paul and Ben are doing right now is a huge part of this. If we can help public transportation agencies serve their riders better while saving a cost per trip and helping get Waves on the street, so many different wins there that we can keep building on to expand the Wave supply on city streets.
That's great. Thank you for that. And I recognize we're running close on time here, but there's an important question that's actually come up a couple times in the question box. Is that we've obviously talked a lot about folks with physical disabilities, but there's a couple questions about folks with cognitive disabilities, perhaps dementia or other things that may make them apprehensive or give them other challenges to accessing this type of service, even though they might benefit tremendously from it. What are some ways that we've thought of to address those concerns and expand this? And we haven't heard from Judy in a minute, so maybe Judy, I see you nodding your head, you can kick that one off, and then if anyone else has anything to add on to that one before we wrap up.
I like spreading like peanut butter, Chris. I think that's a good analogy. So we often don't think about individuals with cognitive and intellectual and developmental disabilities. More and more, those individuals are around and working, and in the places that we go, there are people. So I think early training and awareness. I do a lot of work with schools, and believe it or not, elementary school students with disabilities in elementary and middle schools, to try to orient them to the various transportation modes that are out there. I've worked with Uber on some national presentations to educate school personnel, the individuals that are helping prepare students for post-school employment or post-secondary education, to help their awareness and even establish relationships between school districts and the TNC, the Ubers and Lyfts out there. But I think modeling is really important. So having individuals that look like me using the service is a really good way to educate and inform. I think having information, if providers can provide information in different universally designed ways so that people can access it, that's going to be an important contributor. And just recognizing that there's a diverse range of individuals. If someone has a diagnosis of an intellectual disability, that's one person. Disability labels are just a label, and everybody has different, the implications of their disability are very different. And so getting to know that and working with the human service organizations in communities who know those audiences well is really critical.
Well said. Any other thoughts on that, or things that, like I said, we've got only about 2 minutes here before we close, and there's a lot of questions that we're not going to be able to get to, but want to see if anyone has any other closing remarks or things that from the panel that you'd like to say before we wrap up.
I think I'll close with first, thanks everybody for listening in, and for the panelists here. Great conversation. As long as we keep the core mission here, which is improving the lives of people with disabilities who are using paratransit at the center of what we're doing here, and then branching out to figure out how we do that, I think that we'll come up with a great system that builds off the great work that that Paul and Ben have been starting here, and really find a new way to tune the system that's been around for 30+ years to really serve the riders even better than before.
Well said. Well, and again, I want to thank our panelists for their remarks. Those on the live webinar, I want to apologize for not getting to all of your questions. We could probably go on for a few more hours to get to them, and there are certainly some good ones. So we'll be following up with a few of you directly, and then if anyone has some specific follow-up or whatever, please feel free to email me directly. My email address is plewis@enotrans.org. You can also find it on our website, along with my phone number. Happy to either try to answer that directly or send you to one of our esteemed panelists here, and we can get your questions answered. For those of you that are looking to get AICP certification maintenance credits, remember that on the webinar's website, you'll find instructions on how to submit this for credits as soon as you're done. And the link should be in the chat as well. But again, thank you everyone for tuning in. Thank you very much to each of our panelists, Chris, Ben, Paul, and Judy, for your excellent remarks and insights on this. It's clearly a topic of great interest, and we hope we can continue the conversation in the months to come.
Everybody, thanks.
Thank you,
everyone.
Thanks, everybody.
Mm-hmm.